Hi, I'm Robert, and together with Cécile, we'll explore how real-world data and real-world evidence can help strengthen your advocacy and support innovation. This training module is part of a series designed to support patients and advocates in using evidence to drive change. When we think about medical research, we often imagine clinical trials, those carefully controlled studies that test new treatments, but real life isn't a controlled lab. Every day, people live with conditions in unique ways, using medications differently, managing side effects, and combining medical care with their own lived experiences. That's where real-world data and real-world evidence comes in.
Exactly. When we talk about real-world data, it simply means health information collected outside of traditional clinical trials. It captures how healthcare is actually delivered in everyday practice. Real-world evidence is the knowledge we derive from analyzing all this data. Real-world data come from the world we actually live in. For instance, electronic health records and hospital database, which documents patients' clinical information and treatments provided during care. It also comes from insurance and pharmacy claims, which show how treatments are prescribed, dispensed, and reimbursed in real practice. We also gather data from wearable devices or health apps that captures real-time measures such as daily activity like walking. Patient registry and surveys collect information about specific disease or treatment groups over time. And importantly, patients' reported outcome shared through advocacy groups provide direct insight into how people feel and function while managing their condition. This is all snapshot of how people experience health and treatment in their daily life. As a real-world evidence scientist, I think of real-world evidence in a bridge between what patients experience every day and how decisions are made about new medicines. Real-world evidence lets us see how treatment works for people in their actual daily lives, how they feel, what challenge they face, and whether a medicine truly helps them function better. For rare disease, this is especially important. Real-world evidence can show early on whether therapy is making a real difference, and that helps get promising treatment to patients sooner. Payers and regulators, which are the public body assessing the safety, the efficacy, and the relevance of an innovation. They want more than just numbers. They want to know this therapy profoundly changed lives. In 2024, a systematic review of FDA approval found that nearly half of rare disease therapy, including real-world evidence, to support their efficacy outcomes. This was crucial when the treatment's impact was pronounced. That fact underscores real-world evidence growing value in regulatory decision-making. That's why patient data and input matters so much. They can directly influence decisions that lead to faster, fairer, and more meaningful access to care. So when patients share their experiences, they are not just helping themselves, they're helping shape how future treatments are developed and assessed for the whole community.
Real-world evidence reminds us that every patient's story counts, that my story, my symptoms count, not just in advocacy, but in science itself. By sharing our data, our experiences, and our voices, we help shape the healthcare system that sees people and not just patients. Real-world evidence also creates a more inclusive research setting, as in rare diseases where there may be only a handful of patients or they live far from the clinical trial setting, real-world evidence connects those patients to a potential treatment. So why does real-world evidence matter so much for advocacy? Real-world evidence is important as it helps patient advocates understand how a disease can vary in different patients. Each symptom is unique to a patient and may evolve as a disease progresses. For instance, I'm a Charcot-Marie-Tooth disease patient and researcher, and I'm involved in lots of patient-centered conventions. Pain was always a topic of discussion, but I never felt I experienced pain. That was until I learned what some neuropathy patients meant as pain was being misconceived as neuropathic pain. However, by patients sharing their experience, I realised that the pain they experienced was musculoskeletal or muscle pain. This is something I experienced myself, but I miscategorized it as pain from not working out enough or being unfit. So by patients sharing their experience and their symptoms, I learned more about my own symptoms and disease.
The way different healthcare stakeholders view and use real-world data has changed significantly in recent years. Today, we have clear guidelines and a growing recognition that real-world evidence is a powerful tool to support decision-making. Regulators now accept real-world evidence for drug approval, particularly in rare disease when traditional trials are limited. Payers look for real-world evidence proof to assess whether treatment truly improves patients' quality of life and worth the cost. Doctors use it to guide clinical decisions and to adjust care based on what works in real life. Policymakers are also incorporating real-world evidence into health programs to better address patient needs. However, this new perspective is just the beginning. We need to keep pushing for this change, encouraging more stakeholders to embrace and trust real-world evidence. By sharing their data, patients can influence this conversation and push for better access, care, and outcome. As a real-world scientist, my role is to help turn the personal story and experiences that patients share to meaningful data that can guide healthcare decisions. We often begin with qualitative feedback interview, open survey, or patient conversation. This gives us rich real-life insight, but they are not always easy to measure. This is why we use tools like a Q5D to measure the quality of life or other patient-reported outcome measures to translate those experiences into numbers. For example, if a patient says, "I feel too tired to go to work," we may use a fatigue scale to assign a score to that experience. When many patients report similar challenges, we can identify patterns. It helps us track how symptoms affect daily life and how treatment makes a difference. Once we have translated this feedback into data, we ask ourselves a key few questions. Does this insight help inform a clinical, regulatory, or policy decision? Is it something we are hearing from many patients, not just a few? Does it reflect our mission to improve patients' outcomes? And importantly, does it tell a story that others, like regulators or payers, will understand and care about? We also make sure the data is reliable by comparing it with other sources, like clinical outcomes or treatment records. Once we have validated the data, we use it to tell a story that combines both the numbers and the real-life experiences behind them. We also think carefully about how to frame the data. For example, regulators want to see how treatments improve quality of life. Payers want to know if it's cost-effective. So we present the data in a way that speaks to their priorities, while we are staying true to the patient experience. It's all about balance, combining the emotional weight of real story with the credibility of solid data. That's how we make sure patient voices are not only heard, but drive real change in healthcare. Thanks to new frameworks and tools that support the use of real-world data, patient-generated insights are now more influential than ever. But we still need to keep pushing, because when patient voices are measured and shared effectively, they can lead to better care, faster access, and more informed decisions for everyone. We have seen how real-world evidence can inform policies and clinical decisions. But what happens when patients themselves contribute their experiences? How can this insight make a real difference in their disease journey?
Every symptom is important to a patient. Every patient wants to make a difference in their disease outcomes, and every patient group wants to enable that possibility. Real-world evidence enables that, as what gets measured gets improved. By participating in real-world data collection, patients can have an impact on their disease. It is important to understand disconnects between a patient's lived experience and what's on their medical records, particularly in slowly progressing rare disorders. This means if a patient can detect a change in disease progression or quality of life, but a medical profession can't, it can be detected and monitored. A good example of this is the My Real World MG project that was launched by argenx together with an international myasthenia gravis patient organizations. Through a simple mobile app, people living with myasthenia gravis could regularly share how they were feeling in everyday life, whether they had more difficulty keeping their eyelids open by the evening, or if they felt weaker when climbing stairs, or noticed slurred speech after talking for a while. They could also report when they felt stronger after rest or after treatment changes. These reported outcomes are currently being used in several clinical trials to facilitate the translation of a patient's lived experience of a drug and therefore assess innovation. So what should you keep in mind as a patient advocate using data? Make data personal, purposeful, and persistent. Decision makers respond more strongly when data reflects lived experiences. Align your data with the specific decision or policy you're trying to influence. Use longitudinal data that shows trends over time instead of taking a single snapshot. A longitudinal study follows patients repeatedly to see how their experiences, their symptoms, or their quality of life changes over time. For a patient advocate, this kind of data is powerful because it shows trends and progress. Remember, every symptom you report, every change you notice, has the potential to improve care, not just for you, but for the whole patient community. Thank you for your time and kind attention. I hope it helps you as a patient and a patient representative. For more information, you can also check resources from your patient groups, Eurordis, Rare Disease Europe, or Every Life Foundation for Rare Diseases and UPATI training. Feel free to contact them directly.